Have you ever wondered what truly happens to a man after prostate surgery? Beyond the clinical explanations and medical charts, what does this procedure mean for his body, his confidence, his relationships, even his very sense of identity? Today, we are going to have a deeply honest and compassionate discussion about something that many men fear but rarely speak about: the physical, emotional, and intimate repercussions of prostate removal surgery. This isn't just another medical procedure. It's a life-altering event that can shake a man to his core, affecting not just his health but his relationships, self-esteem, and quality of life. If you or someone you love is facing this journey, you need to watch this video until the end.
Why?
Because too many men go into this surgery without fully understanding the long-term impact on their bladder control, their sexual function, and their emotional well-being. They aren't prepared for the challenges, the setbacks, or the unexpected changes that follow. In this video, we'll uncover Small Blue Diamond, the hidden truths about how prostate surgery changes the body and mind. Small Blue Diamond, the emotional struggles men often suffer in silence, and why they don't have to. Small Blue Diamond, real solutions for overcoming the most difficult side effects, including urinary incontinence and erectile dysfunction. Small Blue Diamond, how men can reclaim their confidence, intimacy, and quality of life post-surgery. This is not just about medical facts, it's about real people, real struggles, and real victories. Whether you're considering this surgery, recovering from it, or supporting a loved one through it, the insights you'll gain here could make all the difference. Stay with me as we break the silence, challenge the stigma, and empower men to take control of their health, their relationships, and their future. Because no man should have to navigate this journey alone. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. The unspoken truth about prostate surgery, a journey through the body, mind, and heart. Today, I want to have an open, honest, and deeply compassionate discussion with you. One that, as a doctor and sexologist, I know carries immense emotional weight. We are going to talk about something that many men fear but rarely speak about aloud: the physical, emotional, and intimate repercussions of prostate removal surgery. This is not just another medical procedure. It is a life-altering event, one that can change how a man experiences himself, his relationships, and even his sense of masculinity. It is a subject that deserves our full attention, not just from a clinical perspective, but from a deeply human one. I invite you to stay with me as we embark on this important discussion, where we will shed light on the realities, both difficult and hopeful, that come with this procedure. Together, we will analyze the physical challenges, the emotional roller coaster, and the deeply personal impact it has on a man's confidence, identity, and relationships. This is not just about science, it's about real people, real struggles, and real victories. And most importantly, we will approach it with respect, dignity, and sensitivity, because every man facing this journey deserves to be seen, heard, and supported. The role of the prostate, more than just a small gland. To fully grasp the significance of prostate removal, we must first understand what the prostate is and why it matters. At first glance, the prostate may seem like an insignificant organ, a small, walnut-sized gland tucked away beneath the bladder and in front of the rectum. But its function in the male body is crucial. The prostate is the engine behind semen production, providing the seminal fluid that transports sperm during ejaculation. Though it is not considered a vital organ, meaning a man can technically survive without it, its influence on sexual function and urinary control is profound. Because of its location and role in the body, any alteration in its structure, whether due to disease, enlargement, or surgical removal, can have significant and often lasting effects. For many men, the prostate is not just a gland, it is a symbol of their masculinity, vitality, and even their ability to experience intimacy and pleasure. The difficult decision, when surgery becomes necessary. For some men, prostate removal, a procedure known as a prostatectomy, becomes a medical necessity. The most common reasons for undergoing this surgery include prostate cancer, a devastating diagnosis that leaves many men feeling like their world has been turned upside down. Prostate cancer is one of the most common cancers in men, and when detected early, a prostatectomy is often one of the primary treatment options to prevent its spread. Benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate that can cause severe urinary problems, making daily life unbearable due to frequent urination, painful urination, and difficulty emptying the bladder. Chronic prostatitis, a long-term inflammation of the prostate that can cause chronic pelvic pain, discomfort during urination, and painful ejaculation, leading to significant distress and frustration. While prostate removal can be life-saving, it is also life-changing. It affects more than just physical health. It impacts mental well-being, self-image, and intimate relationships. The decision to undergo this surgery is never easy. Many men struggle with the fear of losing control over their bodies, their sexual function, and their sense of self. And these fears are not unfounded. The aftermath. How prostatectomy changes the body and mind. The journey after prostate removal is one of adjustment, resilience, and self-discovery. While the goal of the surgery is often to remove cancer or relieve severe symptoms, the body undergoes profound changes in the process. The two most common side effects, urinary incontinence and erectile dysfunction, can significantly impact a man's confidence, independence, and emotional well-being. Urinary incontinence, a loss of control that feels like a loss of dignity. One of the most distressing side effects for men post-surgery is urinary incontinence, the loss of bladder control. For some, this means occasional dribbling or leakage when they cough, sneeze, laugh, or lift something heavy. For others, it means frequent, unpredictable accidents that require the use of absorbent pads or even medical devices. Studies show that up to 50% of men experience some degree of incontinence after prostate removal, and while many improve over time, the journey to regaining control is frustrating, exhausting, and emotionally taxing. The fear of having an accident in public or the embarrassment of needing to wear protection can make men withdraw from social activities, leading to isolation and depression. Fortunately, there is hope. With time, Kegel exercises and pelvic floor therapy can significantly improve bladder control. But patience is required, and for many men, this can be a test of resilience and self-acceptance. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. The impact on sexual function, when intimacy feels like a distant memory. Perhaps the most emotionally charged consequence of prostatectomy is the effect it has on a man's sexual health. The prostate is deeply intertwined with a man's ability to experience arousal, erection, and orgasm. During surgery, the delicate nerves responsible for sexual function are at high risk of being damaged. Even when surgeons take precautions to preserve these nerves, many men experience significant changes in their sexual response. Erectile dysfunction, the most common and feared consequence. Without the prostate and with possible nerve damage, achieving or maintaining an erection can become difficult or even impossible without medical assistance. Weakened orgasms. Many men report that orgasms feel different, weaker, or even non-existent after surgery. Some no longer ejaculate at all, a condition known as dry orgasm. Loss of sexual confidence. The fear of not being the man I used to be can cause anxiety, self-doubt, and avoidance of intimacy altogether. For men in relationships, this can create emotional distance between partners. Feelings of shame, inadequacy, and frustration can creep in, making it difficult to openly communicate about these changes. Many men withdraw, feeling as though they are no longer desirable or capable of fulfilling their partner's needs. But it's important to remember that intimacy does not have to end. With patience, support, and the right interventions, medications, therapy, or medical devices like penile implants or vacuum erection devices, many men can redefine their sexual experiences and find new ways to connect with their partners. A new beginning. Finding strength in the journey. Prostate removal is not just a medical procedure. It is a transformation that requires courage, resilience, and adaptation. The road ahead may be challenging, but it is not the end of intimacy, masculinity, or happiness. It is the beginning of a new way of living, one that may require adjustments but can still be fulfilling and meaningful. With the right medical support, physical therapy, emotional resilience, and a willingness to explore new possibilities, many men find that life after prostatectomy can still be rich, vibrant, and full of love. If you or someone you love is facing this journey, know that you are not alone. There is help, there is hope, and there are ways to reclaim your confidence and joy. Let's talk about it, support each other, and break the silence surrounding men's health. Because every man deserves to live a full, empowered, and dignified life, no matter what challenges come his way. The emotional and physical toll of prostatectomy in older men. The human body is a remarkable yet fragile system, and as we age, its ability to heal, regenerate, and function optimally becomes increasingly compromised. Nowhere is this more apparent than in the aftermath of a major surgical procedure like a prostatectomy. Despite the tremendous advancements in modern surgical techniques, ones that strive to preserve the intricate network of nerves and blood vessels vital for erectile function, the harsh reality remains that age significantly impacts the likelihood of a full recovery. The outcome of this procedure is not merely dependent on the skill of the surgeon, but is also shaped by a man's preoperative sexual function, his overall health, and his body's natural ability to adapt to trauma. For many men, the possibility of losing their ability to engage in spontaneous intimacy feels like a devastating blow, one that extends beyond the physical body and into the deepest recesses of the heart and mind. Erectile dysfunction is not simply a mechanical failure. It is an experience that can shake a man's confidence, alter his sense of self, and profoundly affect his relationships. Some men may regain their sexual function over time with extensive rehabilitation therapy, medications like phosphodiesterase inhibitors, such as Viagra or Cialis, or even assistive devices like vacuum erection pumps. However, the process is neither immediate nor guaranteed, and for older men, the challenges multiply exponentially. The unique risks for older men. Undergoing a prostatectomy at an advanced age introduces layers of complexity that younger patients may not encounter. In youth, the body's resilience allows for quicker healing, more robust tissue regeneration, and greater overall adaptability to physiological changes. In contrast, older men must endure a much longer and often grueling recovery process. Tissue healing slows, immune function weakens, and the very systems that regulate inflammation and repair become sluggish, making complications more common. The ability to bounce back from such an invasive procedure is not merely a matter of willpower, but one of biology. This is why comprehensive pre-surgical evaluations are absolutely crucial. Before moving forward with the procedure, older men must undergo rigorous health screenings to assess their heart function, blood pressure stability, metabolic health, and any underlying conditions that could jeopardize their recovery. Many doctors require patients to undergo cardiovascular assessments since the stress of surgery, combined with the anesthetic and potential blood loss, can place an immense burden on the heart. For men with pre-existing conditions such as diabetes, a history of strokes, or arterial disease, the risks escalate further. Even in the best-case scenario, where surgery is successful, post-operative recovery for older men is typically longer, more demanding, and fraught with obstacles. Pain management becomes a balancing act, as stronger painkillers can lead to side effects such as dizziness, nausea, and constipation, factors that already disproportionately affect older individuals. The physical strain of healing can lead to fatigue, muscle loss, and a decline in stamina, making even the simplest activities feel exhausting. Additionally, for men with mobility issues, performing essential rehabilitation exercises to improve urinary continence and strengthen pelvic muscles can be frustratingly difficult. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. The emotional and psychological aftermath. Yet, the physical challenges are only half the battle. The emotional weight of this surgery is often even heavier to bear. The psychological impact of losing sexual function, even temporarily, can be profoundly distressing. Many men describe feeling as though they have lost a part of themselves, something deeply tied to their identity, their manhood, and their ability to experience closeness with a partner. This feeling is not irrational. Rather, it is a reflection of the deep psychological and cultural ties between masculinity and sexual vitality. For some men, the aftermath of surgery brings on waves of anxiety, frustration, and even depression. Thoughts like, will my partner still find me desirable? Will I ever be able to experience intimacy again? Can linger, creating a cycle of self-doubt that only exacerbates the problem. The fear of rejection or of becoming a burden can lead some men to withdraw emotionally, pulling away from their partners rather than confronting the reality of their new circumstances. In relationships where physical intimacy has long been a source of connection, the changes brought on by surgery can create strain, misunderstandings, and even resentment if not openly addressed. Additionally, societal attitudes toward male sexuality often make it difficult for older men to discuss their struggles. While women are often encouraged to seek emotional support and counseling for major life changes, men are frequently conditioned to suffer in silence, bottling up their emotions and refusing to acknowledge their vulnerabilities. This silence, however, can be dangerous. Unspoken grief over sexual changes can erode self-esteem, strain marriages, and even lead to feelings of isolation and despair. The role of emotional support and rehabilitation. Recovery from a prostatectomy is not just a medical process. It is a deeply personal journey, one that requires patience, perseverance, and, most importantly, support. Open and honest communication with a partner can make an enormous difference. Those in relationships where both individuals approach the situation with compassion, adaptability, and a willingness to explore new forms of intimacy often fare better emotionally than those who allow shame or embarrassment to create distance. Intimacy is not solely defined by intercourse. Touch, affection, and emotional closeness all play significant roles in maintaining a fulfilling connection. Counseling, whether through individual therapy or couples therapy, can also be an invaluable resource for navigating these changes. A trained professional can help men process their emotions, rebuild confidence, and develop strategies for enhancing their intimacy in ways that go beyond traditional intercourse. Support groups, both online and in person, offer another avenue for men to share their experiences with others who truly understand their struggles, providing a sense of solidarity and encouragement. Moving forward with hope. Despite the challenges, it is essential to remember that all hope is not lost. Medical advancements continue to evolve, offering new treatments and interventions to help men reclaim their sexual function and confidence. In some cases, nerve-sparing surgical techniques can minimize damage, allowing for a more successful recovery. In others, innovative therapies such as low-intensity shockwave therapy or penile implants can provide long-term solutions. More importantly, redefining intimacy and masculinity can be a transformative experience. For many men, adapting to post-prostatectomy life becomes an opportunity to cultivate a deeper, more emotionally rich connection with their partners. While the road may be difficult, it is not one that must be walked alone. With the right mindset, medical support, and emotional guidance, men can find new ways to embrace this chapter of their lives, not as an ending, but as a new beginning. Overcoming the emotional and physical challenges of a prostatectomy, reclaiming confidence, intimacy, and quality of life. Urinary incontinence and struggles with maintaining a satisfying sex life can feel like an earth-shattering blow to a man's self-esteem. For many, sexual function is not just about physical pleasure. It is deeply tied to identity, confidence, and the ability to express love and connection with a partner. When these abilities are altered due to prostate surgery or other health-related conditions, the psychological impact can be profound. Many men struggle with an overwhelming sense of loss, questioning their masculinity, their attractiveness, and their ability to maintain intimacy in their relationships. It is not uncommon for men facing these challenges to experience a mix of emotions: frustration, sadness, embarrassment, and even anger. Some feel as if they have lost a vital part of themselves, leading to withdrawal from their partners out of fear of rejection or disappointment. Others suffer in silence, feeling isolated in their struggles, afraid to open up about what they are going through. The fear of being seen as less of a man can be crippling, causing men to suppress their emotions rather than seek the support they need. Understanding that you are not alone. One of the most important things to remember is that these challenges do not define a man's worth. They do not take away from his value, his strength, or his ability to lead a fulfilling life. Every year, thousands of men go through similar experiences, and while the road may seem daunting, there are ways to navigate it with resilience, dignity, and even newfound confidence. Adapting to this new reality requires a shift in perspective. Intimacy is not solely about physical performance. It is about emotional closeness, shared experiences, and the deep bonds formed between two people. While the body may change, the capacity to love, to connect, and to experience pleasure does not disappear. With the right mindset, medical support, and emotional guidance, men can learn to embrace a new way of experiencing intimacy, one that is just as meaningful and fulfilling as before. If you are still watching this video and find these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Specialized therapies and support systems, rebuilding confidence and connection. Fortunately, there are numerous resources available to help men and their partners navigate this journey together. Specialized therapies, such as sexual counseling and couples therapy, provide a safe and supportive environment for discussing fears, insecurities, and desires. These sessions can be incredibly valuable in helping couples rediscover intimacy beyond physical performance, fostering deeper emotional connections and enhancing mutual understanding. For many couples, therapy opens the door to new forms of intimacy, such as sensual touch, open communication, and exploring alternative ways to experience pleasure. It shifts the focus away from what has been lost and instead highlights what can be gained, a closer, more emotionally connected relationship that thrives on trust, patience, and love. Having a strong support system is equally important. No man should feel as though he has to navigate these challenges alone. Seeking guidance from trusted family members, close friends, or healthcare professionals can provide reassurance and encouragement during difficult times. Sometimes, simply talking about fears and frustrations can lift an immense weight off one's shoulders, making the path forward feel more manageable. Physical and sexual rehabilitation, taking charge of your recovery. Beyond emotional and psychological support, there are concrete steps that men can take to regain control over their bodies and rebuild confidence. Physical and sexual rehabilitation play a vital role in restoring both function and self-assurance after a prostatectomy. One of the most effective ways to improve urinary control is through pelvic floor exercises, commonly known as Kegel exercises. These exercises help strengthen the muscles responsible for bladder control, gradually reducing incontinence and restoring a sense of normalcy. Consistency is key, and with time, many men see significant improvements, allowing them to regain control and confidence in their daily lives. For those struggling with erectile function, several treatment options exist, each designed to support men in reclaiming their sexual well-being. Some of the most commonly recommended solutions include oral medications, drugs such as sildenafil, Viagra, or tadalafil, Cialis, enhance blood flow to the penis, making it easier to achieve and maintain an erection. These medications have helped millions of men worldwide restore their confidence in intimacy. Vacuum erection devices. These devices create a vacuum around the penis, drawing blood into the area to facilitate an erection. While they may require some adjustment, many men find them to be a useful and effective alternative. Penile injections or implants. In cases where other treatments are not effective, medical procedures such as penile injections or implants may be considered. These options provide long-term solutions for men seeking to restore their ability to engage in sexual activity. Exploring hormone therapy and its role in restoring vitality. For some men, the challenges of intimacy extend beyond erectile function and into the realm of hormonal changes. As testosterone levels naturally decline with age, some men experience a noticeable drop in sexual desire, energy, and overall vitality. In such cases, hormone replacement therapy, HRT, may be an option worth exploring. However, hormone therapy is not suitable for everyone, and it comes with potential risks. It is essential to consult with a specialist to carefully evaluate whether this treatment is appropriate based on individual health conditions, medical history, and overall lifestyle. The goal is not just to restore physical function, but to enhance overall well-being in a safe and sustainable manner. Making an informed decision, weighing the risks and benefits. Choosing to undergo a prostatectomy is a life-altering decision, one that requires careful consideration of all factors involved. It is not simply about removing a medical issue, it is about ensuring the best possible quality of life in the years to come. Doctors play a crucial role in guiding patients through this decision-making process. They must provide a clear, honest, and thorough explanation of the risks and benefits, taking into account the patient's age, overall health, personal goals, and lifestyle. Every man deserves accurate information, realistic expectations, and the ability to make a decision that aligns with his needs and values. Here on this channel, our commitment is to empower men with knowledge, to provide accurate, insightful, and compassionate information so that every individual can approach their health with confidence and clarity. We believe in helping men make informed choices that not only address medical concerns but also prioritize emotional well-being, personal happiness, and long-term fulfillment. The journey to a new chapter. Life after a prostatectomy. A prostatectomy is not the end of a man's journey, it is simply the start of a new chapter. Yes, there may be challenges to overcome, but life after surgery can still be deeply rewarding, filled with love, connection, and personal growth. It is important to shift the focus from what has changed to what remains, and what can still be built. Intimacy does not vanish because of a physical setback. Confidence is not lost because of a medical condition. A fulfilling life is still possible, and it is within reach for those who are willing to embrace the journey with courage, patience, and an open heart. The key is to seek out the resources, treatments, and support that best fit your unique situation. You are not alone, and you do not have to go through this process in silence. Reach out, explore your options, and remember, your story is far from over. With the right approach, the best days of your life could still be ahead. We've covered a lot of ground today, everything from the physical changes that come with prostate surgery to the emotional and intimate challenges that men often face in silence. But more importantly, we've also explored real solutions, ways to regain confidence, improve intimacy, and rebuild a fulfilling life after this major transition. Now, I want to hear from you. What's one thing you've learned from this video that you will take with you in your own life? Whether it's a new perspective on recovery, a practical tip for improving bladder control, or a better understanding of how intimacy can evolve, share your thoughts in the comments below. Your experience could help and encourage someone else on this journey. And if you found this video valuable, please leave a comment below, and don't forget to like, share, and subscribe to our YouTube channel. Your support helps us continue bringing you important discussions like this one. Thank you for watching, and remember, no matter what challenges come your way, you are not alone. With the right knowledge, support, and mindset, you can navigate this journey with strength, dignity, and hope. See you in the next video.